in various parts of the state. We've got a lot of them in southern Florida, and I think that'll be really, really important. You know, if you look at the hospital census for folks with COVID, you do have a number of these folks who are in, who really aren't seeking or needing continuing medical care, but they haven't yet cleared the disease, and so they're not going to be discharged back to the long-term care facility. The facilities we have been accepting a lot of transfers. We're going to continue to do that, but I think that that's really an important tool when it comes to protecting the most vulnerable among us. You know, our guiding principles are, number one, protect the vulnerable. I think we all have a responsibility to look after folks, particularly 65 and up, who we know now are more susceptible to really negative effects from this virus than folks in other age brackets. If you are in one of those age brackets, 65 and up, or if you have significant underlying medical conditions, you really should be limiting your contact outside the home, sheltering as much as you can, and certainly avoiding close contact with people who are not part of your household. This virus is circulating amongst the community in many parts of our state, particularly amongst folks who are in the younger age groups. So you have a lot of 20, 30-year-olds. We're seeing this, a place like Miami-Dade, you have a lot of the young people have gotten it, but it has spread to some of the older population, and I think part of that is family gatherings, friends, things like that in multi-generational households. So folks should be very, very cognizant, if you're in those groups, to take the necessary precautions. And if you're not in those groups, you have a responsibility to look out for folks who may be more vulnerable to this virus than you. We also are recommending that folks avoid what we've called the 3 C's, closed spaces, particularly with poor ventilation, crowded places, and close contact settings, particularly a close contact setting for an extended period of time. And that's why the number one source of outbreaks has been the home, because you're under the same roof in an enclosed setting, usually in close contact with family members for an extended period of time. Facial coverings are recommended, especially if you can't physically distance. You have some folks working in certain types of industries where they can't always maintain the 6-foot distance, but that will potentially reduce some of the transmission. So those basic things, I think, will really help us turn the corner. There are some positive signs in terms of, we've heard a lot about the number of cases. We are seeing some positive trends in different parts of the state on positivity that's declined in some key areas. We're seeing some other positive trends on some of the ED visits declining for COVID-like illnesses, but we've got a lot more work to do, but I have no doubt that we'll be able to do it. And it's going to be done by just having a steady resolve, not being fearful, but just understanding what's out there, understanding what we have to do, and understanding that we'll be able to get the job done together. So we're going to be working hard, to get the supplies, to get what people need. We're also going to be working hard, talking with folks throughout the state about some of the way forward in terms of businesses, schools, and all the important things that are so key to our daily lives. So thank you. Thanks everyone for doing their part. And with that, I'm happy to take some questions.
Yeah, Governor, in the last 24 hours, there's been some, the Department of Health has had to retell labs what results they're supposed to submit, both positive and negative. That's one of about a string of, I'm guessing, 5 or 6 things that have gone awry at the Department of Health, from press releases being recalled to having fights over data with some of the newspapers. Do you still have confidence in Dr. Ripke?
Oh, yeah, no, of course. And first of all, with the lab results, just understand what happens. The law requires for reportable illness that if someone tests positive, it's reported. That's kind of the underlying law. We then said, I think in one of my executive orders, report the negatives too. And that's how we look to see % positive and try to evaluate. And there were a number of labs who were just simply doing kind of what the default is, which is sending the positives only without sending the negatives. And so I don't think they were trying to be underhanded, those labs. I think that's kind of what they were doing before this started. And so that was identified. I know they're going to start doing the negatives as well. So I don't think that was an issue with the Department of Health. I think it was more of an issue with the labs. Yes, sir.
There are some hospitals, I spoke with a hospital earlier, who has been reporting positive and negative case results this entire time. And they've seen discrepancies on that spreadsheet where 1 week their positive cases were missing, this week their negative cases were missing.
Which hospital was that?
It was Lee Memorial, and on top of that, Lee Memorial is listed under 8 different names throughout that spreadsheet. So they're going through trying to figure out, and for another example.
Yeah, no, I know Lee had one entry where they had pretty much only positives, and then they had kind of a bigger entry where they kind of had the negatives and stuff. That may be one of the reasons why Lee has always had a little bit higher positivity than kind of the other places in Southwest Florida. But I think, understand, this is labs using the Merlin system to put it in. So somebody, like the Department of Health just didn't put that in. Somebody inputted it that way, and that's just an issue. I mean, we're doing now 90,000 tests a day, so these things are being put in, and it's a huge amount of volume, and so we understand some of the labs, it doesn't always get reported as soon. And that's also why you look at like some of these test results, because sometimes it takes a long time to report them. In some ways, they're kind of a lagging indicator, because if I get results today and I see a case, that's somebody that very well may have been infected 2 weeks ago at this point. And so that's just something to keep in mind. So but we understand that, and that's just kind of the nature of when you have all the data coming in from all these different places, you got to do the best, that you can. I think the percent positivity is a pretty good indicator, but you do have to weigh that against the fact of maybe not all the negatives are there. I know some of the major labs, particularly in April and May, they were submitting the positives quickly, and then they would dump the negatives. So if you look at all our testing, the ramp up as we got into May, there was 1 week where there was like way more tests than we had ever done. And then we went down and then built back up. And that wasn't because we did more tests that week. It was because they had been having for 6 weeks negatives, and then they dumped all the negatives. And so I think that day they dumped a bunch, we had like a 0.6% positivity. Well, that really wasn't the true number because of how the data was put in.
So to be clear, you did support not the
Oh yeah, no, absolutely. Yeah. That's not his fault for the data entry stuff.
112 people were reported dead from coronavirus today. That totals about 4,500 in the state. Senate Democrats had a meeting today, and they want to know how many more people have to die before you consider scaling back on your reopening plans.
Well, we're working hard every day to prevent not only the deaths, but obviously significant hospitalizations. I think if you look at all the efforts that we've done to protect the most vulnerable and compare that with some of the other states who did different policies and maybe didn't put as much emphasis on that, and we've had people from the Florida Healthcare Association, some of them say, we've been able to save probably thousands of lives when you look at all the efforts to protect our residents of long-term care facilities. And so it's something that we take very, very seriously. We're doing all we can because every life counts, and it doesn't matter whether you're 10 years old, 30 years old, or 90 years old. We want to be there and do the best we can to help folks, particularly those who are the most vulnerable to a nasty virus.
Governor, back to school issue. I'm wondering, do you expect that the Department of Education is going to provide to local counties some protocol when it comes to what happens if a child tests positive? Who gets isolated? How all that, the mechanics, the testing of children. Is that all going to be part of the?
So I think what the department's doing is working with the State Department of Health, and then obviously each district working with their county health department on those protocols. I think as we get through this period in terms of how the testing is going to work, I think we'll have to make some decisions just generally about because here's when you test healthy people, especially, which we're doing now a lot, and you go get tested, and you actually are negative, right? But then the lab gives you results 7 days later. You may have been infected in those 7 days. And so in some ways, a negative can be a false sense of security. So clearly, if anyone develops symptoms, we want to have the ability, to do a test. I think that's very, very useful. I am not sure that just saying, hey, test on the first day of school, oh, you're good. It's not like it's an antibody test. I mean, this is a snapshot in time, and as we know, even though I believe that the younger kids in particularly, seem to be more resistant to this, the fact is, you're probably going to see different transmission as this stuff goes. But yeah, I think the health has got to be very paramount, and I think working kind of and I don't think it's going to be uniform throughout the state. I think you'll see different localities approach it in different ways.
Do you expect the schools to have the authority to test children, on site?
Well, I think that's a very good question. I mean, typically, I don't know that we would be able to just force you, to take tests. That's why I think if you're symptomatic and you're sick, then that's probably a different question. But I do think that there are probably some issues. I mean, when we do the long-term care testing, we do not require, we offer it to the residents, but you have some that just don't want to be tested. We do not force them to be tested. Now, we do the staff and make them do it, but they're regulated as part of working in these facilities, so it's a little bit different. But I do think that there are significant issues with that, but I think that those are things you're going to have to work out. But clearly, if you're doing it with folks who are symptomatic, then I think it becomes something that's probably going to be easily defensible.
What would you do differently? And what kind of course corrections do you think need to be made?
Well, look, I think that you're seeing that. I mean, remember, when we were going through this in March and April, a lot of folks were focused on, what is being restricted or shut down or all that. And I think if you look at it, most of the behavior was changing before a lot of that was happening. And I think what we've seen recently as the cases have risen, as it's become more of a center stage issue again, is we're seeing changes in mobility data. We're seeing people do the social distancing. We're seeing folks who are vulnerable making the extra effort. And I think ultimately that is what's going to do it for us. I was in Miami-Dade with Mayor Jimenez and a lot of the local leaders, and they've done they were one of the first counties in the country, I think, to close. They were closed for 2 months. They had a very, I think, measured, dip the toe in the water into phase one. They've had things like facial coverings. They've had different things going on. They've pretty much done, I think, all the things different people have recommended at different times. And I think it's really going to be turning the corner with focusing on these key behaviors. And that was kind of the message.
Exactly everything that you need to do right.
Well, we're working every day. So if you look at, what we're doing, say, with the testing of the long-term care facilities, we didn't have the capacity in March to test every worker. As we got into May, we were expanding it. We knew we were going to finish going through with that. We knew we had the opportunity to really make an impact on that. We're working very hard to be able to support the healthcare system with all these personnel. It's very, very important. That's the number one. Every person I talk to who runs a hospital, it's all about the personnel. They see traffic. They understand what they have to do. First of all, I think a great story is just how good some of the physicians have done compared to what the results were in March, particularly in other parts of the country. I think they've learned a lot. I think that they're using appropriate treatments that have now kind of been developed and tried over the months, and I think the results are better. So obviously, we wish this could just go away. That's just not how these things work. And so, as people get infected, we hope that people can fight it off and they don't end up needing medical attention, much less hospitalization. But if they do, I think that they're in pretty good hands, and I think that you're in much better shape today going into a hospital in the state of Florida than you would have been in March pretty much anywhere in the country. And I think that they've done a really good job.
Mayors in Miami yesterday were talking about is that they felt that they wanted to see a more unified, urgent message from a statewide approach. They mentioned that some people are getting kind of mixed messages. And we heard it again today from some of the commissioners at the Board of Education, that the education order was confusing to people. Is it a good idea for you to have sort of this one size doesn't fit all approach And shouldn't you have more of a consistent?
No, first of all, the message with Miami-Dade is consistent. You know, I'm supporting the county mayor in what he's doing. I'm supporting those municipal mayors. I may not agree with them on everything politically, but this isn't really about politics, or it's not about the typical tit for tat. You know, we have a task at hand. When the mayor calls me, we're there to help, and we support, you know, what they're doing. And there should be no, that is very clear. At the same time, I mean, the fate of Miami-Dade County does not rest on the fate of what Dixie County does. That's just the reality. And so I think it's served us well to recognize the diversity of the state. Now, in terms of the education, you know, I understand the commissioner is, you know, has done some stuff on that, and I think that's fine. But I mean, at the end of the day, you know, these school superintendents have unique constituencies, and it's going to be a collaborative effort. And I don't think it's going to be just the Department of Education. I think they can recommend, but I don't think they can dictate every decision on this. I think if you talk to parents, I think the view is a little more fractured in terms of what should happen with the schools. I think, you know, probably early June, there would probably been overwhelming say go back, because, you know, we had low positivity, low cases, and things were stable. Now, as you've seen this, I think there's naturally concern about, you know, what does this mean for schools? What does it mean for safety? And I think different parents look at it different ways. And I think and that's going to be different in each different school district. You're going to probably have a different breakdown in Broward than you will in some of these other places. And so you need to be able to recognize that. It should not be dictated by the Department of Education. I think they can recommend, but ultimately, you know, we want every school district to do what's best for the kids, for their education, to make sure they have opportunities to do well, and also making sure that the parents have the agency, so that, you know, if you have a school district, you know, that's offering the in-person instruction which many parents think is very important, you know, if you have parents that aren't comfortable with that they have the ability to opt for distance learning. And so that is what it's got to be. But I can tell you there is going to be differences in how this operates. And actually, there should be. I mean, because if you look at Miami-Dade and what they're doing in terms of their epidemic, although we did straighten out the percent positive, I was talking to Mayor Jimenez, I'm like, you always say you're higher than the numbers I have. So I think we worked that out. So they've been about 20%. They were 16% a couple days ago, but they've been about 20%. Obviously, we want to get that down, but that's a different profile than maybe some of the other places who, it's not like nobody has seen coronavirus. Every county has seen it, but it is just different. And so I think that's a good approach. I'm hoping that you know, we really work and can turn the corner with Miami-Dade. I feel like most of the rest of the state, you know, you kind of see a positive trajectory that we can get to. In that one, I think in Miami-Dade, you know, a lot of the Broward hospitalizations are people that actually live in Miami-Dade, and they're going to across the county border to be hospitalized there. So let's work understanding that there's a lot of differences and a lot of diversity, and you may see that first day of school look different in say Northwest Florida than you do in Miami-Dade. But quite frankly, I think that's how most Floridians would want it to be. I think that they understand that. But there is a consistent message when it comes to education statewide, and that is parents have the right to choose the appropriate environment for their child. And if they want to opt for distance learning, then they should absolutely be able to do that, and that option should be provided for them. Thank you.
You gotta go outside for that? Give a speech?